period for the AI and for the consolidated plan is fiscal year 2020-2021 through fiscal year 2024-2025. So the AI includes an analysis of barriers and impediments to fair housing choice defined as the following. Impediments are any actions, omissions, or decisions taken which have the effect of restricting a person's housing choice or the availability of housing choice because of race, color, religion, gender, disability, familial status, or national origin. Such a limitation to fair housing choice constitutes housing discrimination. Barriers to housing choice are factors that limit a person's ability to choose from a variety of housing types and may not constitute housing discrimination. Factors may include housing supply and location, physical accessibility of housing, zoning for group homes. The development of this AI is part of the consolidated planning process required for all entitlement communities, such as the City of Hemet, that receive housing and community development funds from the United States Department of Housing and Urban Development, that are known as HUD. The time period for the AI, as stated before, is fiscal years 2020-2021 through fiscal years 2024-2025, a time period that aligns with Hemet's 5-year consolidated plan. The draft analysis of impediments of Fair Housing Choice and Fair Housing Action Plan, also known as AI, was prepared by Castaneda and Associates, and I believe he is on the line as well to assist with any questions, in accordance with the format suggested by HUD, and has been reviewed by the Planning Department and City Attorney for consistency with the general plan and city ordinances. The fundamental purpose of the AI report is to maintain the City of Hemet's compliance with the affirmatively furthering fair housing certification. In doing so, the city will promote fair housing and remove or improve the public and private sector impediments that have been identified through the analysis. In general, the report indicates that the City of Hemet is in compliance with the fair housing requirements. Hemet's practices are consistent with fair housing laws and affirmatively furthering fair housing. The following slides list the public and private sector impediments and the recommended action. Do you want me to read through all of them? No? Okay. Wait 1 second here. Okay. The fiscal year 2020 through 2025 AI has a table that lists the prior year AI impediments and the status. And below the list of the impediments that have not been achieved, there were 3 that were not achieved. Public sector impediment 1, lack of community awareness of the city's reasonable accommodation procedure was not accomplished. The recommendation is to prepare a brochure or flyer to promote the reasonable accommodation procedure and prepare an application. Private sector impediment 1, lack of accurate information on accessible housing unit was not accomplished. The recommendation was to prepare an inventory of accessible apartment units and encourage apartment managers to advertise the availability of these units. And the last one that was not achieved was private sector impediment 2, Section 8, assisted households residing in high poverty neighborhoods. Recommended actions were partially achieved and will work on completing the actions during the 5-year period coming up, 2020 through 2025. The goal of the City of Hemet with funding from CDBG is to increase self-sufficiency and economic opportunity for lower income residents and individuals with special needs so that they can achieve a reasonable standard of living. Specifically, from July 1st, 2020 through June 30th, 2025, the city has established the following priority needs and subsequent goals as a guide for allocating CDBG funding. The first one is housing. enhancing affordable home ownership through education, preservation, and rehabilitation, and enhancing affordable rental housing through education and preservation. Number 2, public facilities and infrastructure, improving existing infrastructure, community and public facilities. Number 3, economic development, retain and expand economic opportunities through infrastructure enhancement. Number 4, homelessness, support the local continuum of care strategy to aid homeless persons and families and to end chronic homelessness. Number 5, non-housing special needs, provide supportive services for persons with special needs, including youth, elderly, and persons with disabilities. For fiscal year 2020-2021, the projects that are slated to be funded once our application is approved is Caravan Transportation Services, the Center Against Sexual Assault of Southwest Riverside County, Fair Housing Council of Riverside County, Family Services Association for Senior Meals, Valley Intervention Program for Tots, which is a child care program, Valley Restart Shelter, Shelter and Technology, Valleywide Recreation and Park District, Youth Scholarships, Voices for Children, Foster Youth Advocates, and City of Hemet Administration Code Enforcement, Crime-Free Housing, Senior and Disabled Home Repair, Engineering, and Library. So that is all I have for you. If you have questions, I can do my very best to answer them. I'm hoping that Veronica's on the line to answer that, and we do ask that the council open a public hearing for this.
Okay, well, I'd like to open the public hearing on this, and I'd like to note that public comment opportunity for this item was provided during communications from the public. Sorry. I'll try that again with the mic on. I would like to note that public comment opportunity for this item was provided during communications from the public. Are there any comments from council on this item? Carly?
Don't bring my neck, Chris, because I didn't get finished reading it till late last night. One thing I thought that we could add into this was, since we kind of went over the homeless task force and kind of transitioned into the community outreach committee, somehow those people in there have, I mean, there's a lot of, from the homeless outreach team, from the homeless task force, that are all in there, and somehow they should probably be incorporated into this. And I don't know how you do that, but it's new and it's different, but
it's actually a really good item. And I know that we did some outreach with respect to this and gathering input. I think the timing of it may have not been ideal to allow that to happen, but I think the next time we do any sort of activity like that, I think it's really imperative that we do that. So we can definitely do that moving forward.
I mean, as far as the plan and deciding and decisions and dealing with homelessness, we have people in our city who are doing it, not just the continuum of care.
Yeah, I understand your point. I think it's very well noted too.
But I mean, we can't add it into the plan, I mean, just as one of the other bulleted items?
There is a component, I believe, in there, but I think that input really, the opportunity would have been to capture that on the front side versus right now there is a deadline for us to submit that. So the timing of it is not in our favor right now.
That's how everything is, but
yeah,
this is a
when we do
city committee.
Yeah, I think when we do our when we do our 1-year action plan, if Veronica's on the line, what flexibility do we have to move some of those items around to address various needs that pop up in any given year? I think that's really what the option is moving forward.
Hi, this is Veronica. Yeah, we can add that information with every annual action plan.
It just doesn't exclude it.
Correct. I think this is the 5-year kind of planning document but each year there is an opportunity to update the action plan for each individual year based on the needs that do come up. So I think that's where the input would go into for the individual years versus capturing it in this specific document. Does that answer the question?
Yeah, I mean, I guess. I think it would be easy to edit a Word document.
So the question that I have is, Veronica, I think what the council member is alluding to is if there's a desire to allocate some or reallocate funding for, let's say, homeless activity instead of using it for the continuum of care, what mechanism do we, or that I'm just paraphrasing what the council member said in terms of the continuum of care not being the only mechanism to deal with the homelessness issue. If the city were to look at some sort of option that it had to deal with it on the city level, what would be needed on the ground level in terms of the staff to gather the input from the Citizen Outreach Committee and gathering the input on that side? What's needed to accomplish that goal?
Okay, I'm not sure I understand, but if we're looking to fund a project that the city would like to do, we can do that in the next round of the renewal action plan,
And I'm not
which would
talking
be
about like a
21-22.
right, and I'm not
Am I
talking about
understanding
a
that correctly?
project to spend money on, but like maybe it would fall under like, and on pages like even in 15 in the table where it says agency groups. I mean, it's part of the city of Hemet. It's a committee that we right.
Okay, I see what you're saying.
I'm not saying it needs to be a project. It just right, because like if you go back to the slide that you showed, we got dinged for not having community participation, and now
I see
we
what
have.
you're saying.
It's
Okay.
a good thing that we have a community outreach committee now.
So now I understand it.
Yeah.
So adding that group as a resource
Or it may fall under already what we have.
into
I
this
don't know.
document is what you're referencing. So Veronica, I think the council member brings up a good point. We do have a group that's been formed to deal with this and other types of activities that are in line with this activity. What is our ability to add that into the narrative of the document itself before it gets submitted to HUD?
If I get the information
That's already here.
as soon as possible, I can add that information into the consolidated plan.
And we're not an agency, but you know we listed the city of San Jacinto, and we have all of our departments. We don't have a homeless department. You know what I'm saying? So it may be included in this. Yeah. Okay.
So Veronica, can you add that into the consolidated plan without having to ask for an extension?
Like one sentence.
Yes, I can.
Okay.
So we can definitely add that to provide the resources, because this will be a public document, in terms of the resources that are available. So I apologize for misunderstanding that, but I understand it now. We can do that.
And with the dinging, I mean, that's a good job for some of these volunteers that we can help with for the future too.
Okay, we can definitely do that, yes.
Okay, that's it. Linda?
I have a question. Now I lost it. The slide that you had on the dings, as far as Section 8, I honestly don't understand that, and I'm looking at the private sector impediments. Section 8 assisted households residing in high poverty neighborhoods is inconsistent with HUD's goals. Well, what if we don't have any that aren't there? I mean, what do we do? Force somebody to put their house on a Section 8 market for rental? And I realized my voice just got a little sharper there. But seriously, if information is out there to a person who wants to rent the house, shouldn't they have the freedom of choice whether they want it to be rented to this person or to become a Section 8? And I'm not dinging Section 8 housing or the people who live in them, because I know a lot of people who do, and it's fine. But I mean, to mandate that we're getting dinged because of this, And maybe they don't understand 99% of Hemet is low rent.
I don't think it's that they mandate it. I think it's that we made it part of our analysis of impediments for the previous 5 years. I don't see it on our current one, though. Veronica, is that still on there?
No, it's not. And Ralph, are you on the line? Maybe you can provide more clarification on this question. Okay.
Sorry.
I don't hear him.
Okay, good question.
Veronica, can you hear me?
Yes, yes.
Oh, okay. Yes, the Section 8 recommendation is not included in this 2020 to 2025 AI. It was deleted.
Thank you. That's all.
Okay. So it was referenced as being lacking in the previous one, and it doesn't appear in this one. Tommy, questions, comments?
Correct.
Okay. I have no questions. So that's, we've had the report. We've had questions and comments. Anyone interested in making a motion? We already did that. Okay. Closing the public hearing.
Mayor Brown, we need to provide public comment opportunity during the public hearing.
I thought we did during public comment.
Not on public hearings.
Okay. I'll get this right. Okay. Reopen the public hearing. Are there any comments from the public on this public hearing item?
I do have one electronic comment submitted by Susan Larkin,
Okay.
which states, regarding homelessness data, the point-in-time count reflects partial data. Valley Restart Shelter served over 46,000 meals, 9,113 of which were to community members. VRS provided emergency shelter to 208 persons, including 62 families with 142 children. 57% were homeless for the first time. 74% exited the shelter to permanent housing. In addition, VRS provided showers to an average of 5 homeless persons a day, 32 unduplicated persons a month, who were not staying at the shelter. Finally, the VRS outreach team engaged with 142 homeless on the street or other places not meant for human habitation, and helped obtain housing for 23% of them. End of comment.
Thank you very much. That was the only one comment you had?
That was the only electronic comment. I'm not sure if there's any on the line.
Is there anyone on the teleconference call that has a comment on this public hearing item? Okay, hearing none, I will close the public hearing, bring it back to council. Anyone interested in making a motion?
I will move staff recommendation number 2 that the City Council approve the 2020-2024 Consolidated Plan, CDBG 2020-21 Annual Action Plan, and the 2020-2024 Analysis of Impediments to Fair Housing Choice and Fair Housing Action Plan, and authorize the City Manager to sign the certifications and grant application for submission on or before April 15th, 2020 to the Department of HUD.
Okay, I have a motion and a second to approve the staff recommendation. Roll call vote, please.
Councilmember Meyer? Yes. Councilmember Wright?
Yes.
Mayor Pro Tem Krupa?
Yes.
Mayor Brown?
Yes, that motion passes 4-0.
Thank you, Council.
Thank you, Lorena. Thank you, Veronica. Okay, moving on. Item 19 is receive and file. Typically, these are routine items. So we've somehow started a tradition of taking a motion and a second and a vote on these. So we'll continue with that practice.
I have one question, or actually 2 questions on some of these real fast. And I don't know that you'll have the answer for me right now, Lorena, but there's 2 Hemet rubber stamp invoices, and they're like a penny different on the same date. Hemet rubber stamp. I can send them to you tomorrow, but I saw them this afternoon, and I was just, the invoice numbers has an A and a B, and they're like a penny off, so I was just making sure that that was, you know what I mean? And then my other question, goodness, I keep moving from the mic. Let me find this one. My other question is there's a M. Pino and Associates, Inc. for $4,680 for background investigations. And it was dated, well, it was just this last month, but 4/23/20. And we're in a hiring freeze, and that's a lot of money for background checks. So I don't expect you to tell me now, but.
Yeah, we'll follow up and provide
Okay.
an update.
I saw it this afternoon, and I was, okay, thank you. All right, I'll make a motion to approve.
Okay. May I have a second?
Second.
I have a motion and a second. Roll call vote, please.
Councilmember Meyer,
Yes.
Councilmember Wright,
Yes.
Councilmember Purcell is absent. Mayor Pro Tem Krupa,
Yes.
Mayor Brown.
Yes, that motion passes 4-0. Moving on to item 20, consent calendar. All consent calendar items will be acted upon simultaneously unless requested by an individual council member for separate consideration. Are there any council members who would like to pull a consent calendar item for separate consideration?
I just have a fast one, 20B.
20B? Okay. Anyone else? Okay, I have a request to pull item 20B for separate consideration. May I have a motion on item 20A and 20C?
So move. Second.
I have a motion and a second to approve item 20A and 20C. Roll call vote, please.
Councilmember Meyer? Yes. Councilmember Wright?
Yes.
Mayor Pro Tem Krupa?
Yes.
Mayor Brown?
Yes, that passes 4-0. Item 20B.
And this is probably a question for our attorney, but on this item, when we designate the Riverside County Health Officer as the one who decides, is there a way we could put language in there that says, or its designee, or our designee, or something like that? Because what if we decide, what if one of our local doctors decides, hey, I want to be involved? We have the right to do that without changing.
I would recommend that we keep the resolution as is. The designee, state law requires us to designate a local health officer, which is, in this case, the Riverside County local health officer. If at some future point the city decides to hire its own local health officer, then I would suggest just revising this resolution at that point.
All right. That's fine. If that's what you think. I'm not sure that I'm 100% with everything that's in this document, but it is what it is, I guess.
Any other questions or comments from council? Hearing none, I'll entertain a motion on item 20B.
Move approval on 20B.
I have a motion to approve
Second.
and a second. Roll call vote, please.
Councilmember Meyer?
No.
Councilmember Wright?
Yes.
Mayor Pro Tem Krupa?
Yes.
Yes, that motion passes 3-1. Noting that Councilmember Meyer was a no vote on that. Moving on to item 21, discussion items. For each item, the city manager, Lopez, will provide an introduction, and at the close of the report, we'll have public comments, but we've already had public comments earlier on, so I'll get this squared away about the time that we lift all the restrictions. Okay. So we have item 21A, consider the benefits of membership with California Joint Powers Insurance Authority, CJPIA, and provide direction to staff.
Thank you, Mayor. So by way of background, the council did direct staff to provide a provisional withdrawal notice to CSAC. In the time that the council authorized that, we were also accepted by the JPIA into their program. And so there are two items, main items that the council can choose to move forward on. One, the council can either decide to maintain membership with CSAC, or two, it can choose to move forward on a number of items to complete the membership with the JPIA. And we have packaged this up into bite-sized pieces. There are some more subsequent items that will be coming before you with future meetings to ensure that we have all the entire package together. But that's really what we have before you today. Again, Eric has done an incredible job in packaging this all up together for the council. So with that, we'll go ahead and hand it over to Erica for the staff report.
Good evening, Mayor and Council. So as we discussed last meeting, you guys discussed the desire to become more proactive in our risk management. So we've gone through a series of steps with the CJPIA to see if they would be a good fit for us. So this staff report that I provided you really goes through what they provided us in the initial risk management evaluation. Pause for a moment. John Scholl, are you on the line?
Yes, I am.
Okay. Hi, John. John with the CJPIA is with us tonight. So this staff report focuses on what the CJPIA will provide us through their evaluation of our practices, the contracts, our risk management, things that they kind of concluded from talking with our staff. So there's not that much in this presentation. It really is detailed in the report. So the first thing that I have is training. So based on what they talked about with our HR staff, looking at our records, a lot of the deficiencies that you will see in that IRME report that you have is that we weren't able to provide when they asked, hey, what do your records look like? Show us your records for this training or this training. We weren't able to do that. So even if we were doing those trainings, we didn't have that evidence. So that's one big thing that they pointed out that we will address as members on the CJPIA. So you'll see on the presentation, heat illness prevention plan, fire prevention plan, a hazards communication plan, or a respiratory protection program. So with membership on the CJPIA, they have a portal, they have example policies for us to literally come back to you and say, hey, council, this is what we will need to do. So if you do choose to become members of the CJPIA, you'll see a lot of us in the first 6 months probably where we're coming back and implementing a lot of programs and policies that will kind of close up our risk exposure. The second one that we pointed out on, and if you see in the top corner, you will be directed to the page number where you are in the packet. They discussed our facility inspection program, sidewalk inspections, playground equipment inspection plans. So all of those things will be addressed as members on the CJPIA. And then when they looked at our contracts, they also saw some things that we can improve on our contracts. So there will be blanket language of indemnification and hold harmless language. They will also kind of set a standard for our insurance requirements. So anyone who decides to do a rental agreement, facilities, anything like that, there will be a basic requirement. So it won't vary from case to case. And our ride-along waivers, our volunteer waivers, all of those things we will update to conform to what CJPIA recommends, which is best practices for risk management. So if you look at the cost chart on your sheet, in your agenda, it is a little different because I included the property line, and I did that just so you have the best idea of what our costs will be for fiscal year 2021. The other costs, as noted in your report, are the same because CSAC was unable to provide their final numbers for this year. But as Councilmember Meyer pointed out, we did give them that updated payroll estimate, so that is in conformance for both of the estimates. And we have CJPIA's final numbers, and CSAC wasn't able to provide those. So we're pretty much comparing what CJPIA provided as final and what CSAC may cost us. With all of those considerations, you'll see that CJPIA is about $33,000 below the cost of CSAC for this next fiscal year. And I do note that with membership on CJPIA, our Lexipol subscription is paid, and that's about $18,000. So that's another budget savings that we would realize as members of CJPIA. Correct. Some considerations that you should be aware of is the way CJPIA handles their claims is that we as a city would fund a trust account that's within our control with our staff, and based on the average of our losses, they're going to give us the number and have us fund that account, and then the JPIA staff will handle our claims. So right now, our city clerk and a member of our finance staff kind of participates in that process. So under JPIA, we'll receive the claims and we will pass it over to their staff, and they will manage it based on best practices. And we will fund that account based on our loss control, so our finance staff is working with their staff to determine what that number would look like. Another consideration that you must know of is if we do this, we're committed for 3 years. There's no backing out for 3 years, and any program that we leave in CSAC, we will not be able to return to. One of my concerns when I looked at this is the fact that we've been part of CSAC for more than 20 years. We've been there for a long time. And each year for each program, we get some subsidy funds, and that is supposed to be used for risk management trainings and practices and stuff like that. So we had this bank that I'm like, we're going to walk away from all of this money. But because we're going to maintain our membership in the property program, which renewed in March, we will still access those funds. So if we were to move to JPIA, we will have the next 12 months to spend some money.
Actually, before we go on to the next slide, I do want to point out that on that claims management item, that's a really key component, because the value in the JPIA is that they are the experts in claims and risk and exposures and what the values are and what it all means. And so by transitioning over to the JPIA to manage that, we're really relying on experts to provide their expertise in this area, and we hope to benefit from their expertise on this.
So I wanted to highlight each of the resolutions that was a part of your packet, just so you know what each one is doing. So the first one and the second attachment is just authorization to become part of the JPIA. And the second one gives the authority for the JPIA to manage claims. And as Chris suggested, it really just goes hand in hand with best practices and mitigating our risk and really just trying to change the way we're doing things. The next one is pooling of self-insurance for the excess program. So we have to make sure that we understand that they're not providing us insurance coverage. We are providing ourselves insurance coverage, but as a member, we're pooling our resources to handle any amounts that are greater than what we can do. So that's for the excess liability. And the next one is for workers' comp. And then the last one is extending coverage to workers' comp, extending workers' comp coverage to our volunteers. So I thought that you guys might have questions about that last one. So I spoke with their staff, and it's a risk management best practice that under workers' comp, and this power would lie with the city manager to extend that coverage to any volunteers, but under workers' comp, they limit the amount that they can request and sue for. So without that extension to volunteers, they can file a civil claim and there's an unlimited amount. So it's just a best practice, and JPIA's members do adopt that resolution as a best practice. So if the council chooses to stay on CSAC, we don't have to do anything. If we do decide to go ahead and pursue membership on the JPIA, all of the resolutions in your packet would need to be approved by the council. We will also need authorization to send final cancellation to CSAC. We have to do that by the end of this month. And finally, the council will need to appoint a delegate and an alternate to serve on the JPIA's leadership team. With that, I ask for any questions.
Okay, thank you very much for that very thorough report and summary. And for the record, an opportunity for public comments on this item, as well as all subsequent items on this agenda, was provided during communications from the public earlier in the meeting. Do any members of council have comments or questions? Carla?
First of all, the volunteer, hold on a second, the volunteer one. I understand that, I don't know, that we're in a budget crisis, and so we're going to add more, so that's concerning to me. I don't know how many volunteers have filed workers' comp claims. I mean, we have the employees in the last however many years, but do we have our own volunteers, or have we been sued, or?
I don't have that number, but we can
that would be a number that we would need to know for risk.
Yeah, I think really the issue is that currently as it stands, and correct me if I'm wrong, John or Erica, a volunteer could essentially now file a claim against the city, and there is no cap with that. Providing that covers the volunteers now provides a cap to that and doesn't expose the city to a larger liability that could be there that is already there. So that's really what that practice does for the city. It helps cap that potential liability moving forward.
Do we know like how much additional that is to provide that service? I mean, it's something that we have to weigh out if we are really trying to cut our budget down.
It's incorporated within the program itself.
Right, there's no additional cost.
So, okay, that's funny. Okay, then on page 59 of 61, so that would be our agenda packet, it's page 532. We have our cost indication page. So, and you can go back and forth on here to the number of claims. So, 2 pages before that, 2019, we had $419,000 worth of workers' comp claims, right? Then and so you are recommending that we get the primary amount?
Correct.
The almost $2 million? Because if you look at if we pay $2 million and we paid out $419,000 of claims, then CSAC made how much money?
So Councilmember Meyer, the page that you're looking at is the excess workers liability program. So we're not going to be going for the primary program and excess liability. So if you want to look at workers' comp, it's on another page. And if you look at page 534, you'll see workers' comp. Let me look at my chart. This is the chart that the JPIA staff prepared. But our cost is, for workers' comp,
534 of, let's see, I'm looking at which numbers, because 534 of our packet, it's not it.
Yeah.
534, let me see here. Okay, I found it.
No, I think. No, I'm sorry, you're right. It is that $2 million for the primary program.
Okay, so so my question is if we're trying to save money, then would we pay? We have no idea of knowing if that $19,000 is one claim, 5 claims, right?
Yeah, I think really what we're looking at is the numbers of claims and the exposure that we have on the workers' compensation side that really is providing that value that's there. So it's really about the activity that we have, primarily in our public safety operations, that provide that number based on historical numbers and the exposure.
We didn't get historical numbers on that. We only got historical. I mean, is it on? Let's see. It's on the little graph. So there were claims that were not even $50,000 in that time frame. I'm just as a council, we need to balance out, and it's just like the marijuana stuff. It's just talking it out because, I mean, you know, like buying insurance, do you get a cheaper plan and have a higher deductible? You know, do we pay an extra $100,000 for the claim, and are we going to save money in the long run, or are we just going to take the easy way and get that most expensive? Because if we're cutting our budget, then we need to cut it.
So we could choose, if the council desired, to opt into the excess workers liability compensation program. So the excess would then subject us to our SIR of $250,000, and then we would be responsible for paying all of our claims up to that amount. If that's what the council would like to do, we could get a quote for that premium.
Or like this one is you pay $100,000, it looks like, for each one, right? So if you had 5 claims, you'd have to pay $100,000, then you would have... We maintained the same SIR, which was $250,000, but we could also explore I'm just saying,
a different SIR.
How much that would save us $800,000. So just weighing out the difference.
And I think that's a good point. What we did was we looked at what CSAC provided, and we just kind of shifted everything to what it would be provided under the GPA.
Right.
So we wanted to make sure that everything was as consistent as possible. But I think, as Erica alluded to, there is that option for the council.
And don't get me wrong, like, I am going to vote for this because I'm excited about all that they're providing. I'm just looking at, you know, we're trying to fill this budget deficit, and that's another $800,000. It looks like our workers' comp claims, if you go back 2 pages, you know, have been lower the last 2 years. Now you can see the jump in 2017. And it's a risk, right? I mean, that's the whole thing with insurance.
Honorable Mayor, if I may.
Yes, John?
Hi, good evening, Honorable Mayor, members of City Council, John Scholl, Chief Executive Officer of California JPIA. If I could just address this one issue. If you look at page, I believe, 529 of 651, you have the frequency and severity stratification. And that shows the last 5-year average of losses up to $100,000 of about $780,000. 10-year average is about 691. So if you were to take that 780 and you looked at the page 532 and you took that 780 and added it to the $1,179,000 for the excess program at $100,000 retention, you're about breaking even going with the primary program or the $100,000 retention. With the primary program, that's your amount. With the excess program, if you have a good year, you quote-unquote win. If you have a bad year, you will pay more. If you have more frequency of those losses up to $100,000, you may pay more than you pay in the primary program. Since the city was already in the primary program with CSAC, the discussions we've had with the city staff, it seemed from our perspective as well as the staff's perspective that being that it's close to the same amount of cost, it would be more prudent to maintain that consistent, you know what you're paying, as opposed to that potential of a bad year. Even though there's a potential of a good year, at this point, the potential of a bad year is a little bit more problematic.
Right, and I understand your job, but I am looking at your profit. So we're strapped financially right now, and we're trying to save money. So I understand what you're saying, and I see the 418 and 392, then it goes up to $1 million. I don't know. Have we run the numbers on that?
Well, I would also note that the most recent years are very green, as we call it. It's hard to know how much those actually will develop over time, but they are definitely looking better than a few years beforehand, and that may be a matter of management. It could be a matter of changing exposures, but we typically use 5 to 10 years worth of data to look at.
Okay, and then my other question for you is the resolution on page 548. The second whereas, it refers to the joint powers agreement. We don't have that. The third whereas, it talks about the workers' compensation, self-insurance, and loss pooling program. I don't think we have that defined. Then we go back down, section 1, it talks about the primary workers' compensation program memorandum of coverage. We don't have that. The city manager of the city is authorized to direct, and this talks about the certificate of consent to self-insure. So this keeps referring to self-insured, but we're paying the premium that's listed here. It's almost $2 million. That's section 3. Section 4, the city will subsequently require to make annual contributions and annual contribution adjustments as provided in Articles 17 and 19 of the Joint Powers Agreement. And what is it? Do you know what that says?
So sorry, I can't see both at the same time. The memorandum of coverage is basically the insurance policy which says we will provide statutory benefits to your employees. In regard to the volunteer issue, which was discussed previously, currently your volunteers don't have access to workers' compensation. Their only way to get recovery from the city if they are injured while volunteering is to sue the city under liability, which has no caps, as opposed to statutory limits under workers' compensation. And that's why we encourage that. Not part of your question, but to get back to that. The self-insurance is a pooled self-insurance program. The primary workers' compensation program is a pooled program among all of the cities that are participating in it. They self-insure based upon an allocation formula that generates the annual contributions. So that's the annual contribution. It is adjusted annually to reflect what is your share of exposure, your share of experience. So all of those have been provided to your staff. You're at 651 pages in the agenda now. We can certainly get it up many more pages.
I have one more question on this page, and so then it will help you tie this all in. But on section 5, it has the coverage, after referring to this whole thing as self-insured, which I don't know that that's correct. It says, and then section 5 actually says, that coverage is provided on a first dollar, that's assuming self-insured, right, incurred per claim basis, and there is no self-insured retention level. So I say all that because you have to be a special classification to be self-insured. You have to have enough money to be able to cover all of our problems, which we don't have a lot of money of, for all these things. That's why we're coming to you. And we're paying a premium. And the premium, saying that we're self-insured, implies that we're getting a refund on the balance of what we did not use. Is that going to happen?
That's not what it's saying. If I can clarify.
I'm just saying self-insured means things, and so I understand what self-insured is.
So there is a self-insurance pool where all these cities have come together to self-insure under the government code. We're not governed by the insurance code. We're governed by the government code. It's a contract agreement among the cities. The self-insurance portion is what the pooled members are self-insuring. The reference to a self-insured retention for the individual member city is what's being referenced in Section 5. If you were in our excess program, you would have a self-insured retention of 100,000, 150, 200,000. But in the primary program, there is no self-insured retention. It's the first dollar coverage.
Okay. And I say okay because first dollar is assuming it's self-insured. So the term is.
First dollar coverage means you get the claim, you send it to us, and we start paying from the first dollar.
Right. So you have the trust account, and you're taking the money, and we're putting our whatever monthly or however we're filling that trust account, right? But at the end of the day,
the liability program, they're the trust fund.
okay.
With the workers' comp program, it's primary coverage. You pay the premium, we pay the claims. You pay one contribution per year. Actually, this year we're splitting it in two to help with cash flow for members. But you pay that one contribution, and that covers your year. With the liability program, there's a trust account for you to fund your retained losses, your self-insured retention in the liability program. In workers' comp, there's no self-insured retention.
Okay. I just don't, I don't know. There's a lot in here that's missing, so a lot of information we don't have. So I guess, I mean, I want to do this, but there's a lot, and then we probably need to talk about like the premium amounts. I mean, do we want to just play the game and pay the highest? I don't know.
Yes.
Yes, Bonnie?
John, I have a question. Whatever we decide regarding coverage tonight or in the near future, how long does that stay in place? Is there a point, is there a time if we decided this, we wanted to go in a different direction, maybe we wanted to change coverage next year, or what is the time frame when we could change whatever we initially decided?
Go ahead.
I'm done.
So if you wanted to change from the primary program to the excess program, and you basically the 3-year commitment is to be a member for 3 years.
Okay.
You can join the primary program. You could decide tonight you want to join the primary program, but between now and July 1 decide you want to be in the excess program. We can make that happen. If you want to change next July 1 from the primary program to one of the excess programs, you can do that. Alternatively, you can go from the excess program to the primary program.
Right.
Really, the only commitment is the 3-year membership that you will be a member of the pool for 3 years.
Thank you for that clarification.
The other thing that I want to bring up, too, as it relates to the workers' comp side of it is, as you know, the governor just took action to provide the coverage for individuals that may contract COVID-19 while on the job. So I know that there's a lot of discussion about reopening. Some businesses have begun to reopen. And so I would just want to let the council know that as the governor took that action, that may, the city may have to deal with an employee that contracts COVID-19 and the potential ramifications down the road on that. So the timing of it is really unique at this point.
Well, and to consider the second phase that they're expecting, so not just at the end of this one, but what we can expect by the end of the year.
Anything further?
Not yet.
Okay. Linda?
John, on the workers' comp and the premium of the initial contribution of $2 million, if our claims analysis or risk comes back considerably less than that in the second year, do we get a reduction in what we put in there, or does that $2 million continue for all 3 years?
if there is a significant change one way or the other, it will be adjusted. Typically in the first year or two, the data coming in, because by the time we're quoting your indication for next year, we won't even have finished this upcoming year. So it's difficult to make that. There won't be much change typically the second year. By the third year, there may be a little bit of change by the third coverage period. But if there is a significant change in your experience, or you change your exposure in some manner, if you were to change your department structure or add a new operation that you're not currently doing, or get rid of an operation that you're currently doing, and it changes your exposure, that would definitely be reflected.
So through your tutelage of education for all of our departments, we could make an assumption that our exposure rate should go down.
We certainly expect your experience to go. Your exposure will, if everything else were to stay the same, your exposure, same employees, we would expect your experience to be better.
Yes, and I kind of.
Which would lead to.
Yeah, at one point in my life, I sold insurance, and workers' comp was part of it. But also with the range of cities that are a part of this JPA, we kind of fold into like the mid-range population and budget exposure-wise, payroll-wise.
Let me take a quick look. Yeah, you're about right in the middle, actually. Yeah, maybe a little higher than the mid-range for payroll, but about the same, I'd say.
Okay. Well, I just had experience with this. I'm on the board of directors for RTA, Riverside Transit Authority, and at one point they belonged to a JPA for all of their insurances, and they ended up, excuse the expression, but being the big dog in the pool, and ended up really kind of subsidizing some of the ones that were paying less monies, so we opted to go into the other aspect of private insurance for them. But during the period of time they were in it, it was an extremely valuable and cost savings method for them. So thank you for that. I'm done.
Okay. Chris, did you have something that you wanted to add? I saw you reaching for the microphone.
Yeah, I'm fixing it.
Oh, okay.
But beyond that, there's just a really difference in terms of how the JPI operates. Just yesterday, I think it was, there was a quarterly city managers meeting where John provided updates to the city managers on best practices for COVID. As a matter of fact, there's an FAQ section on their website, and there was something that I pulled off of their website that we'll be utilizing already at some of our facilities with respect to COVID-19 and providing information, notices to the public about COVID-19 and the risk associated with that. So there's a number of things that have happened just in the last few weeks in terms of how the JPIA operates that is clearly different than what we're currently receiving. And it goes back to that philosophy of doing things differently. So very good conversation at yesterday's meeting. And there's a lot of value that goes into those conversations that we had. In addition to that, the information that they put out to the city managers in terms of what's kind of the hot button issue that we need to be looking out for. So I can appreciate that too.
Russ, the other thing I wanted to say is that I appreciated the login information. I kind of got a little behind on my agenda packet because when you log into the JPIA page, and if you guys haven't done it, there's so much to read, and so that was really nice. That was very informational. You thought it was junk mail? Nice. And then the other thing is the report that was included in here. The things that we don't have in place. And you think, Erica mentioned we were with, bless their hearts, CSAC for over 20 years. And then to see the things in here that need to be fixed, I'm glad that somebody is looking out over the professionals that we're trusting to do their job, because there's some things that need to be fixed,
Well, I think these are all good comments, good questions. John, I appreciate your response to that. Just from my perspective, kind of taking a 30,000-foot view of this, and I certainly concur with my colleagues. We appreciate all the good service that we've had through CSAC, and this does represent a different approach, and both services are equally good. What was particularly attractive to me, and I mentioned this in our last discussion, was the proactive approach, because I think the one thing that